Hello, my name is Tessa, and I will be doing a massage for Corrina today. We're going to be doing massage to relieve some tension in Corrina's low back, and I'm actually going to start with some compressions and active release in the glutes. So, compressions before any type of active release. And to start, I do not go in with max pressure, but fairly firm. And sometimes I'll just hold my wrist to make sure that it's straight. You can also use your forearm or your elbow for this type of work. And I'm actually going to move into the SI joint just a little bit, kind of start waking everything up a little bit. And for active release on the glute, you want to make sure that there's very little resistance in that leg. And you want to go in from the side and nice firm pressure. Not max pressure, but and right now I'm just getting a sense of what areas feel the most contracted. And this is something that takes a fair amount of concentration. You definitely can't just tune out. You want to work effectively. And sometimes if I find a spot that is a little more stubborn in responding, I'll just spend a little more time. And with active release, you don't have to do big movements. You can. Sometimes that's effective, but sometimes the most effective is just smaller micro movements. And it really depends on your client and their body type and just what they're dealing with. And if you feel a certain spot kind of tensing or offering a little more resistance, just be patient and spend a little bit more time. And always for the low back, I like to include a little bit of glute work and some hamstring if there's time, even if it's just a few compressions. So compressions are just a great way to increase blood flow and stimulate the just health of the muscle. And I'm not going to spend a whole lot of time in the glute area or the hamstrings. I'm going to move to the opposite side. And going in with some compressions first. And starting lighter and then working my way into the muscle as I hold the compression. So it's not just a static movement. And I'm just holding my wrist to make sure that I'm not bending it. And I'm going to start to go in with a little bit more pressure and hold for just a little bit longer. And I'll often do this with my elbow or my forearm. And I'm going to start warming up this SI joint area. Just getting a sense of how everything feels from right to left. This is kind of an awkward angle to work on the SI joint. It's a lot easier to work going down this way. And active release in this glute. And first just making sure that there's not resistance in that leg. Sometimes if your client is feeling a little more tense, you can actually lift the leg. And just going in with these smaller movements, getting a sense of how things may feel different on this side. And starting to increase my pressure as it feels appropriate, depending on how the muscle's responding. And still doing pretty small movements with that leg. And some compressions in the hamstring. This hamstring feels a little bit tighter than the opposite side, and that could mean that the left side of Corrina's low back might be tighter. And I'm going to go ahead and grab some oil and start on the back. Some therapists actually like to work without oil. You have a lot of nice friction on the muscle. I like to use just the right amount of oil or lotion. And just scanning that SI joint area, seeing how things feel from right to left. And I'm going to start just going in with my thumbs, nice light pressure. And just working my way into the hips a little bit. And the side joint at the same time a little bit. Just trying to create some more space with low back. And it's nice to go from broader surface area to more detailed work. Just using that nice soft fist. I'm going to start getting into this SI joint a little bit more and the hip. You just need to be careful that your wrist doesn't hurt because you are kind of bending it a fair amount. And just using the heel of my hand and working my way down towards the hip joint at a diagonal. And moving to the opposite side. Really just, I'm focused on creating more space in the hips and that low back area. You want to go nice and slow. You can even work the erector muscle a little bit and kind of start with a soft fist and then move into that SI joint hip area. Just a little more work in that erector spine. And the SI joints feel like they're ready for a little more detailed work. And Corrina's left side does feel a little bit tighter. I'm going to go in both of my thumbs. And just creating more space. Working this SI joint in this way can relieve a lot of pressure and tension in the low back. And you can find whatever angle works best for you as far as moving into that SI joint. It's nice when you can work with both thumbs. It just kind of takes the load off of using just one. And I just like to check in with both thumbs to see how each side is feeling before moving to the opposite side. And sometimes if one side feels significantly tighter, I'll revisit that side. Kind of walk your thumbs. You can just find whatever technique works the best for you. And I'm gonna pop back over to this left side. There's a good chance that Corrina's psoas on the left is really tight. So if she were a client of mine, I would definitely work on that psoas a little bit. And I'm going to go ahead and just hold this pressure. So I'm really going in with kind of the max pressure that I'm going to use. And this is a nice place to kind of shake out your hands if you need to. Doing a lot of thumb work. And I'm going to work my way into this QL muscle. It's a little harder to access this muscle. It's small and just kind of hard to find.
You're at about like 15, 16.
Okay. Sometimes I'll go in with my elbow. It's actually easier than trying to use the thumbs. I'm going to start working my way towards the tailbone. There's a lot of nerve endings. I'm just going to tuck this under a little bit. And I'm going to start just walking my thumbs. And just stimulating these nerve endings is really healing for the glutes, for the piriformis, and the low back. And even here you might feel that there is a difference from right to left. And just nice, consistent pressure. And I'm going to stimulate the fascial connective tissue along the spine a little bit. So it's actually best if you do this with less oil. It's kind of like feeling like a rug burn almost. You're just really stimulating that connective tissue in a nice way. And it should feel really warm underneath your fingers. And just kind of checking in with those SI joints. And just a nice stretch for Corrina's low back. I'm just going to put my left hand on Corrina's upper back and I'm going to press away towards her tailbone. It's a little harder skin on skin. It's a lot easier if you're on top of a sheet or whatever. So I'm gonna just go ahead and offer a little bit more decompression by pulling Corrina's legs. And you may not see this in the camera, but I'm just gonna grab hold of her one ankle at a time. And to start, I just make sure that there's not resistance in that leg. So I'll pull.
That's okay. You can, it was just loud.
Okay. I'll pull slightly 2 or 3 times. And finally, I'll just grab hold and gentle shaking. And opposite, I'm going to grab hold of Corrina's left ankle. And same thing, just checking in to see if there's resistance in that leg. And just gentle shaking. That is it for our low back massage. I hope that you enjoyed this video and I hope to see you again soon.
If you enjoy these videos, please join us at PsycheTruthPatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit PsycheTruthPatrons.com. Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by PsycheTruth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.